You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to a special two-part series of the Pharmacy Podcast Network's exclusive press coverage of ATRIUMX 2025, the first of its kind pharmacy conference that took place February 27th through March 1st in Orlando, Florida. ATRIUMX wasn't just another industry event. It was a collaborative experience bringing together forward-thinking pharmacy owners and industry experts to tackle the biggest challenges in pharmacy today. With co-created sessions, real-world solutions, and a community-driven approach, this conference redefined what pharmacy conferences should be. So whether you were in Orlando for ATRIUMX or missed out on this one-of-a-kind event, don't worry, we've got you covered.
Matt Gilbert, RX Safe, here at ATRIUMX. Welcome to the show.
Hey, thanks for having me, Todd. Great to be back.
It's great to have you back. I think it's been a while, and I think the last time we were talking, we might have been talking about long-term care in and of itself. The hot topic at this conference has been kind of that, but it's long-term care at home. And the panel discussion, which was pivotal, I was so honored to be a part of it, was really dialing into the ingredients of long-term care at home. And one of those ingredients is adherence packaging. You have to have that in the mix. So talk to us about the evolution. You've been around long enough to remember when we didn't really have that term. I think we used to call it combo shop.
Correct.
And now it's got its official name. But talk to about the dynamic of that and what that means for the opportunity for our independent community pharmacies.
Yeah, well, I think the greatest thing being here at Atrium was listening to a bunch of industry experts, and I put the quotations around experts, but they're putting up on a board what they want to talk about, what they want to learn more about. And 75% of them put up LTC at home. They want to learn more about. So we did a couple breakout sessions. We had a panel. We layered their cake, as we called it today. And we were looking at new revenue opportunities from existing patients. And that's a huge thing. I mean, you don't have to go out and get new patients. And most of the services that you have to provide per the contracts, you're already doing. You're just not monetizing them now. Yep. So the biggest thing is utilizing some sort of compliance packaging, signing up through GeriMed or whoever your PSAO is, and getting those LTC at home contracts in place, and then delivering out to these patients, making sure they qualify. So by doing that, the average pharmacy is looking at about a $3,000 to $4,000 net profit turn just by turning on those medical at home, LTC at home contracts.
Yep. So what excites me is I feel like we've reached a point. I remember in the day where we would talk about adherence packaging, and it was like kind of like the new kid on the block, and people were like, well, maybe I'll do it, maybe I won't do it. I don't want to say that. I mean, I actually do want to say this. I'll make a bold statement. If you're not moving, if you're a community pharmacy, independent community pharmacy, and you're not moving towards embracing your people in your community that they can't go to a nursing home, it's not available, they're in their home, they need assistance, and you're not delivering long-term care at home in the way that it needs to be managed and designed, you are losing out on so much money and so much profit. And that panel discussion hit it on a nail on the head with all the opportunity. In just the example that they gave was 50 patients out of
Correct.
all the patients that they had.
Yeah.
And I remember that you used to have models that you would pick a patient count and tell them where the break-even point was. And now the break-even point is even lower.
Correct. Yeah. I mean, back in the day, it used to be, 200, 300, 400 patients. It made sense to get that shift over to automation. But the rising costs in labor has driven that way down. And now with these enhanced reimbursements that you have to do compliance packaging with, you're talking 30, 40, 50 patients. It makes sense to move to some sort of automation and get that rolling. And I always use the example of, what would a pharmacist rather be caring about? Placing greeting cards to make an extra 50 cents, or do I want to flip one or two scripts and make $700 more in profit on one patient on one or two meds? I mean, it's just crazy the opportunity the LTC at home provides.
That's right. So we're here at ATRIUMX. I've been to so many conferences. You and I show up at so many of the same conferences. This really has been a dynamically different conference where we came together the first day. We didn't really know exactly what the structure was. Things got voted on, and they dug in almost like a mastermind session to really dig in. What do you think of this conference and how it's been put together?
Yeah, it's been fantastic, and being a founding, partner, we consider ourselves versus being an exhibitor, and that's how we view our relationship with our customers too, right? So it's building out and making sure that they're successful with our equipment. So just a couple minutes ago, I poked my head in and sat in there for 20 minutes listening to more LTC at home real-world experiences from the crowd, and you've got half of those people that aren't doing it yet, and the other half are masterminds in it. And they're all peppering each other with questions, and it's just organic. It's not being spoken to at some big lecture hall at a big 3 conference.
Right.
It's sitting in a room with 30 or 40 of your peers in a breakout session and just peppering them with questions and getting real world feedback with their data, which is incredible.
That's right. And then the pharmacy owners that are here that have already done it are coaching and taking the newbies under their wing. And I've heard conversations where like, hey, we're going to follow up next week and I'll get you started in doing it. And I think that camaraderie is really special. That was kind of like the secret sauce of why everybody liked PDS was
Correct.
The networking events.
Correct. Yeah, and it's huge. I mean, we brought some new stuff to the table, too. We've got a strategic partnership with a company called MedSense who does remote therapeutic monitoring, and I'd say 90% of the crowd had never heard of them and didn't know what RTM was. So we come back to the booth, and we're having real organic conversations of, well, I'm doing pouch now. I want to get into RTM billing and net myself some extra revenue for those services I'm already providing. And just the conversations that lead out of that throughout this conference, in the hallway, at the breakout sessions, at lunch, even before it was 6:30 this morning, I got stopped by somebody in the hallway on the way to the show, and it's all just, everybody has a positive mindset, and they're taking feedback from every part that they can pick out of this show, combining it, and then sharing it with everybody, which is the beauty of this show.
So talk to me about RTM versus RPM, or remote patient, RPM. So it's remote therapy monitoring.
Remote therapeutic monitoring.
Remote
Yep.
therapeutic monitoring versus remote patient monitoring.
Correct.
And there's 2 different billing codes for that too.
Correct. Yeah. So RPM, remote patient monitoring, is your blood pressure cuffs measuring somebody's weight. RTM, remote therapeutic monitoring, which we dispense our pouches through MedSense. What they're looking at is monitoring 2 types of patients. Overriding, it's got to be a Medicare patient that qualifies for it. So to qualify for it, you have to be a patient that's on a drug for a musculoskeletal condition and or a respiratory condition. And you might think, well, that's not too many people. But when they do the analysis on a patient set that they get from the pharmacy, usually it's 70 to 80% of their patients qualify for that service. And what MedSense does is offers a turnkey solution. So they'll not only do the billing, they'll do the analysis to make sure the patient qualifies. They'll also do an analysis to make sure there's no out-of-pocket cost to that patient. So you can offer it at no charge. And to get up and running with MedSense, there's no charge. So it's really a net win for the pharmacy. They essentially get a check cut each month for MedSense providing that clinical service and billing it to Medicare on your behalf.
So for the listeners that might not know, ICON, an organization that was originally a digital light counting system, merged with and took over the RxSafe team. Tell us a little bit about that merger and how that's going.
Yeah. So the parent company of both ICON and RxSafe now is Illinois Toolworks, ITW, based in Chicago. They're a Fortune 200 company, so huge company. They own tons of different businesses underneath that. So big brand names like Rain-X and Hobart Stoves are all under that banner. And what they look to us for is they had ICON, but they wanted to get some more depth and breadth in the healthcare space. So we've taken RxSafe and ICON and merged them together to carve out a pharmacy automation business unit under ITW. And their vision for us is kind of let us roll how we have been. Be really innovative, be a partner, be nimble, and bring new products and new ideas to market. And the beauty is coming to, I probably do 30 trade shows a year. I get all of our ideas from existing prospects and customers and funnel them back up to our dev team and our research team and our engineers and say, hey, this is what the market wants. Let's go make it. ITW now with the huge financial backing says, yeah, let's go do that. That makes sense. That pencils.
That is
So
cool.
so it's been awesome. It's been 14 months that we've been merged now, and they left us alone and just said keep doing what you're doing, which is awesome.
Hey, I remember when RxSafe brought out a new technology that was a identifier through a camera system that would have a whole bunch of different images of the same NDC, of the same tablet or pill, and then based on that, it would give error messages if it wasn't the right pill, for example, because of how many times it turned it and everything. Was that Icon technology? No,
that was our own proprietary technology. So the beauty is we were running in parallel to Icon all these years, and we are actually a reseller of Icon for the past 12, 13 years, and we always sold a rapid pack or rapid card system with an Icon device as part of that workflow. Through the years, we decided, well, maybe we could take that on ourselves and kind of kick it up a notch with some of the visual inspection technology we had. So we took all the technology inside of the rapid pack from an optical perspective, an analyzation perspective, and all those algorithms, and started carving out our own technology. Well, lo and behold, we get acquired by ITW, and
Came full circle.
And now we're taking our technology and marrying it with Icon and improving and sharing ideas and sharing engineering resources, which is just a great thing to watch.
So another thing that I want our listeners to realize, the guidance that you're providing on so many levels, guidance from the from the evaluation process, the implementation process, the training process. My favorite part, if I was an RxSafe customer, is the marketing support.
Yep.
And teaching your customers to be successful with the technology. Talk about that too.
Yeah. So, it really starts pre-sale most of the time. So what we've done, we've carved out a lot of strategic partnerships, but mainly with PharmaComplete, GeriMed, and MedSense. And what we do is if somebody's on the fence or they don't know the right way to steer into, it could be pouch packaging, could be card-based systems, we'll help do analysis through those different companies and actually look at what opportunities they have from their existing patients. Then we take it a step further, and on the RxSafe side, we'll look at what the assisted living opportunities are in that pharmacy's area. We'll look at ICFs, IDDs, corrections, jails, home health agencies, and then we present that to the prospect at the time and go over and say, all right, well, here's your LTC at home opportunities, revenue-wise. Here's your MedSense opportunities. And now we want to take it to the next layer of the cake, and let's go out and let's pull in some assisted living or potentially skilled ICF IIDs, group home business, and it's all powered by using pouch packaging or blister card fulfillment.
That's great. All right, so listeners, if you are a independent community pharmacy and you have not moved into long-term care at home and you want to know how to do it, it might sound a little daunting to you. I want to reassure you, you reach out to Matt, you reach out to the RxSafe team. They have all the players, all of the ingredients we were saying about layering this cake and making sure that you're successful, because it's going to reflect on the success of these models and of these people and of these vendors, and they want you to be successful. And from me being at the ATRIUMX conference and seeing the mix of ideas and the innovation in the heads of these amazing people, you're not going to let them fail.
Correct.
So it's in the best interest for RxSafe to have you be successful. Reach out to Matt Gilbert. Reach out to RxSafe. Go to rxsafe.com. Tell them that you heard the ATRIUMX post show, and make it here to ATRIUMX 2026.
Can't wait.
Joe Bunting from Bunting Family Pharmacy in Northfield, New Jersey. Welcome to ATRIUMX podcast post show. It's the post show.
Thank you very much for having me.
Hey, Joe, I was part of a panel discussion that you and I were on. Thank you so much for doing that. It was great to have an owner up there where we had remote patient monitoring, we had the contracting, we had someone who understood how to put it all together in the blueprint. I called you the guinea pig, but it's it's refreshing to hear a pharmacy owner share good news.
Yeah. I think this is what was so exciting in December looking forward to 2025, where you were more than just hopeful, because this is the first time in a long time where we're always looking at, oh, did you hear about the reimbursement going to be for next year, the different terms, and you're always kind of, each year seems like it gets worse. We're in December, based off of what we had been seeing, especially in that long-term care at home arena, we were very hopeful. And in January, when after we had a complete month where you're looking to see if there's been any turnover, or any changes that might have negatively impacted, not only did we not see that, but we actually saw a $1,500 net profit from the previous month in December. So yeah, it was very exciting. It's a great time to be a pharmacy owner, and also to partner up with some of these other great organizations to help put you in a position to succeed in being compliant.
It's awesome. So one of the things that you said on stage during the panel discussion was going to a assisted living center, dropping off some medication because you got them enrolled, the people that are there. That was one of the examples. And you had mentioned maybe that was a 90-day situation where you're giving 90 days of medication. Go through that again and describe to the listeners the profit in 30-day versus 90-day.
Right. So for for the example of like a long-term care at home patient that might be in independent living, either adult daycare, independent living, high-rise, in order to be compliant from the CMS LTC at home parameters, you cannot bill for a greater than a 30-day supply.
Okay.
So by being in this program, you have to do 30 days or less, unless the manufacturer of, like, say, a cream or an ointment or something like that they were getting would be greater than 30 days. You can't get rid of excess amount to make that compliant. You can't do anything with that, so that would be fine. But the profit that we were seeing that I personally have seen in my pharmacy of approximately $12,000 net profit a month, that is a month. So that's why I didn't want it to be confused where you're like, oh, yeah, well, how often do you get that? You know, because you think of a 90-day supply, we're like, okay, that sounds great, but it might now be 90 days before I get that again. Since you can't bill for greater than 90-day supplies in the LTC at home, you're seeing that on a monthly residual amount, which is incredible.
It's incredible. So for our listeners that you didn't get to attend the ATRIUMX conference, we were talking to MedSense, we were talking to Paul Shelton, we were talking to GeriMed, we were talking about RX Safe. So there are pieces of the puzzle that you have to put together.
Sure.
Talk to us about your specific pieces of the puzzle.
Yeah, so right there is an incredible partnership, and you need all of them to be able to do what I do, and also to be compliant. I often not joke, it's truthful. First off, you can't begin it without like a GeriMed's contract, because without this, you don't have the ability to bill for these different services.
Yep.
So you need that contract, which they provide. You need someone like Paul Shelton, who I always say is the smartest man in the room for a long-term care when he walks in there.
Right.
But being able to put you in a position to succeed. So if you have any questions, because there are some complexities on what you have to do, you're going to have to get a new MPI, NCPDP, long-term care one to bill. And then also from a compliance standpoint, MedSense offers a great opportunity from a compliance standpoint, from working with the patient to see if they have taken the medication when they're supposed to. And then you have another essential group, an RX Safe, from a compliance packaging standpoint, where you are not compliant unless you are putting it in compliance packaging for LTC at home patients. So without that part, so RX Safe is just as important as the contracting. If you're not able to provide that compliance packaging, you're not compliant and with CMS's standards. The other thing too is that it creates some incredible flexibility, especially for that patient population. Say they're independent living, say you've gotten them in adult daycare, where with the strip package, you can just tear off a small amount, and now you have everything compliant. You know exactly the meds that you're taking, if they're going to go to lunch, or again, if they're going to a daily day activity. They don't have to worry about taking 7, 10 different meds out there once popping a pill, and it just creates a much better product. And at the end of the day, it gives better health outcomes for the patients.
I've heard from pharmacies that are using compliance packaging. It came from a story from one of our safes that it was a benefit I never thought of, and that was their patient was going on vacation. They stripped down the number of turns that, how many times they were taking it. I forget what it was, 4, 6, maybe they took an extra one. The story that the patient said was they lost their luggage, they lost all of their medication, and they were without their medication for about almost 2 weeks. And I'm thinking, if you have the strip packs, you're not lost your medication. You leave the big box at home and you just strip off, and it absolutely makes sense.
Yeah, it's absolutely, it gives you so much more flexibility. And even though we've been talking a lot from a long-term care at home population, it's also your business professionals who are traveling around and going to multiple conferences, speaking. It's a lot easier just to tear off something in there and just bring that, and not having to go back to your pharmacy and say, I need a different label now on my vial because I'm traveling with this, and from a compliance standpoint. So it offers up a incredible opportunity to really think outside the box and be able to get a larger population with it too.
I love it. Joe, thanks for being part of the ATRIUMX post show.
Thanks so much for having me.
ICON is the leader in tabletop pharmacy automation, delivering innovative solutions that enhance accuracy, efficiency, and compliance in medication dispensing. ICON's visual precision counting technology eliminates the need for manual pill counting, reducing human error and improving workflow. ICON ensures precise medication counts, minimizing overfills, underfills, and financial losses due to miscounts. Unlike traditional counting machines, ICON captures an image of every transaction, providing verifiable accuracy and helping pharmacies maintain compliance with industry regulations. RxSafe, known for its advanced pharmacy automation systems, enhances operational efficiency with solutions like RapidPackRx and RapidCardRx, which streamline adherence packaging. These automated systems allow pharmacies to provide multi-dose and single-dose packaging, ensuring patients receive their medications accurately and on time. By integrating automation, pharmacies can reduce labor-intensive tasks, improve inventory management, eliminate waste, and increase patient safety. Together, ICON and RxSafe are transforming pharmacy operations by reducing workload, improving compliance, and enhancing patient care. As labor shortages and regulatory pressures grow, automation is no longer a luxury but a necessity. Pharmacies that adopt these technologies can operate more efficiently, reduce dispensing errors, and focus more on patient engagement, reinforcing their role as essential healthcare providers in an evolving industry.
ATRIUMX 2025. I have a hard time saying that already.
Me too.
I'm here with what I would like to say is a good friend.
Oh, absolutely.
He might not want to hear this, a mentor to me, but Chris Corneliuson with Solutions RX, and man, you're doing a lot of good stuff right now. So how do you like the conference so far? Tell me about it.
Dude, the conference has been amazing. I think we all think of ourselves as experts in the industry.
Right.
And I've learned a ton of things today that I didn't know. Also, we all know reimbursement's a problem.
Right.
I've learned tons of legitimate things that pharmacies can do and feel proud of and affect their bottom line. So I thought the ideas here were great.
Yeah, I feel like we're starting to feel like we're pharmacists again.
Absolutely.
We got beat down so hard last year, and I know you got out of the store, but your vitamins and your leadership training has been taken off, which is awesome, by the way. So I'm here. You've been telling me some stories, and it's pretty impressive. But yeah, I feel like we're doing good things again.
Absolutely.
I'm optimistic. So what's something, I know you've been sitting in on these sessions that we're doing. What's something that you kind of heard of that you're like, man, I never thought about that, or hey, I thought about that, but I didn't know if it'd work or something like that?
Yeah, honestly, this isn't a game changer from the excitement standpoint, but the social media marketing session was really good.
Yes.
The functional medicine part that you and TW Taylor did was amazing.
Yeah.
I learned a lot of things in there about how to get your functional medicine started.
Yep.
The 3 pillars kind of a patient. I thought that was really cool. The last session where they were talking about partnering with providers and getting that Medicare payment. And then help me out here, Adam. What was the other thing at the beginning of that session they were talking about?
The RTM?
Yes, the RTM and RPM. And I didn't realize that you could be one or the other. I just knew about RPM.
I absolutely knew nothing about RTM. And so I'm glad to hear about that. So for all those pharmacists out there that are doing like long-term care, and medical adherence and that kind of stuff, there's an RTM, which is therapeutic management, that you can actually bill for.
Absolutely.
Who knew?
I didn't know either.
I know. So that
2 experts here, right? We didn't know.
I don't know about experts, but we know a little bit. But that just goes to show, like here at ATRIUMX, and I'm excited for what Nicolette and them are doing, we're just all brainstorming. I love think tanks.
I do too, and it's been really interesting. Get out in these little groups and then have a topic, and next thing you know, a few questions come up and information starts
we
rolling.
get a little off topic,
Yeah.
and we got to rein it back in a little bit because that's kind of what we do. But yeah, so no, but you're here set up in the booth with your awesome products. I've been using them for a long time in our functional medicine clinic, and even before we had the clinic. So shout out to your products, because I know you do quality at a great price. I was talking to Adam over there, and that's what our selling point is for what you have, is you have a good quality at a fantastic price. So, if any of you pharmacists are out there and hey, I've got high-end supplements, or I want to get into the supplement game, Solutions RX is a fantastic, and you're all support. I mean, of course, I got you on speed dial. I can just text you and do whatever. But the rest of the team, you just reach out and you have any kind of question. So, but yeah, we're glad you're here. So, what else? What do you got going on after this in the supplement space and then in the leadership space?
In the supplement space, we have a new product coming out.
Oh, I can't wait.
Can't tell you what it is yet, but if you'll stay in the loop over the next at least 60 days.
Okay.
I hope it's out in the next 30 days, but the next 60 days it's going to be out. And then, we're going to have some new products roll out. We've hired a new chemist and biologist, and
Cool.
we did that just to increase our R&D.
You're a nerd now.
And, yeah, I'm a nerd now. And, we've got some new products. We've got some new marketing ideas that we're beta testing first. We've got some ways to, we did a thing with Pioneer where it will text the patient before.
Nice.
And not only if you call in, can we go into your computer and set that up for you now?
Cool.
We can do that. We're also experimenting with some other markets and other things that you can do just to help your team out, because the key is consistency.
Yeah.
The key is asking the patients, that fit into a category, making sure you ask them all.
Yeah.
If you ask them all and you're consistent, you're going to make a lot of sales and solve a lot of problems.
And, I can speak kudos about your company, because you all help me in my pharmacies learn how to offer these solutions to these patients, not only with your leadership and your training and your product. You guys are just you're just pharmacy friends, right?
Yeah, I mean, that's what we do.
So your product is amazing. Your company is amazing. So I'm glad you're here. I'm glad to see you guys here when I walked in, and it was kind of like home, right? Like there's a lot of people here. There's a whole bunch I don't know.
Yeah.
But there's a few of you guys, I'm like, oh, yeah, all my peeps are here. So,
yeah, back at you, man.
Yeah, so Chris Cornelius, Solutions RX, check him out. He's online, all the good stuff. But ATRIUMX, man, it's turning out to be a really cool thing, for sure.
Yeah, it's been fun, interesting. It's not over yet.
It's
so
not over
I'm
yet.
excited.
We got one more day. So.
Scotty's doing a keynote. Can't wait to hear that.
I know. What about who knew he knew karate?
Oh, yeah, MMA.
Oh. Anyway. All right, guys. Thank you all for listening. We're going to be doing some more of these for sure, just grabbing people and talking about it. But yeah, ATRIUMX 2025. Thanks, guys.
Mark Joyner at ATRIUMX 2025, the inaugural with Mediska. Mark, thanks for jumping on the show.
Absolutely.
All right, so, I've been in pharmacy for 20 years, and back in the day, everything was super duper divided. Meaning, if you went to ASHP, all about health system pharmacy, you had that clan, you had your specialty pharmacist in your community and your long-term care, your compounding, for goodness sakes. It's blending today. Everything's blending. Kind of give us your perspective of where the blend is, it's happening, and then talk to me a little bit about the blending of compounding into everything.
Absolutely. So, I mean, this is years in the making, right, of a lot of this different blending that you're referring to. And I think what is ultimately behind it is the fact that, a lot of independent pharmacies are starting to see that, just the bill and fill concept is going out the door to where they need to start looking at other resources and other ways of, increasing their cash flow. So whether that's going into compounding and actually starting to look at, creating a business model that's, cash driven versus, reimbursement driven, looking into other avenues to grow your business, whether through telemedicine or starting to purchase things from, 503Bs. So there's a lot of other resources out there that I think people are now starting to explore, and with the advancements in technology as well, I think that's where this blending is starting to come together. So the access to information, the access to data, the access to, patients is that much easier. So now these independent pharmacies now have a much easier ability to bring everything together and get to the patients much faster and easier.
So we're at ATRIUMX. It's the first of its kind. It's a conference that doesn't even have an agenda until you get here, and the pharmacy owners that are here are specifying what we're talking about. Nicolette Matthey kind of gets on stage, and she's like, hey, let's start splitting the groups up. When she got to the compounding section, there were 80% of the people that were here were into compounding.
Correct.
So it is more important than in my 20 years, it seems more important today to get a hold of this and grab a hold of the opportunity than I ever remember.
Absolutely. And what's happening within the independent pharmacy industry is going back to what I was saying earlier as far as, the concept of billing and filling and really scaling your business based off of insurance reimbursement. Those days are kind of out the door. And what compounding offers you is a cash model business and also something that is a lifestyle medication. So if you're into HRT, if you're doing dermatology, things like that, they are maintenance types of medication. So you are going to have a monthly reoccurring, refill that is cash. On top of it, too, the margins on a compound are astronomical. They're higher than any of your other medications that you're dispensing out. On average, you're going to be close to 80%. So your cost of goods is not astronomically high, and your biggest cost when it comes to compounding is going to be your labor force. But that's where Mediska is coming in, and we are future-proofing that, and we're creating a lot of different ecosystems and a lot of automation. One of which is going to be the MAS. It really reduces labor by about 90%. Really, the only thing that your compounding technician is really responsible for is actually the weighing of the active ingredients and the delivery system. Everything else is pretty much automated, and on top of it, we've created an ecosystem that allows you to basically plug and play. So, I mean, if you are creating an HRT topical, we have SOPs, we have videos, we have everything that you need, formulas, education. We now even have our MAS certification course to where you can go to our facility down in Aventura, and you can spend a day there to actually learn about the entire Mediska MAS ecosystem, where you'll learn about topicals, you'll learn about creating topicals with the technology, you'll learn about creating veterinary applications for it. Also, some of our other innovative bases like our Nova Film. It's an intermucosal strip, so very similar like Listerine. So you can load that with an active pharmaceutical ingredient, from ketamine to HRT. One of the more popular ones is low-dose naltrexone. So there's a lot of different diversification of delivery systems that allows an independent pharmacy to diversify and segment themselves out from just your regular, retail. So a lot of these independent pharmacies are moving more of a model to a holistic, to where, they're providing on the front end, whether it be your multivitamins to your daily kind of lifestyle medications, and on the back end supporting you with the compounding. So that's what Mediska does for the independent pharmacy.
So MAS is an actual platform. Is it a software and a management and a whole education system? Like, what is it?
Yeah, so the MAS is really transformed. So back when I first started promoting the MAS, it was a little over 10 years ago, it was really just a device. We had really only barely scratched the surface of the concept. We knew that it was able to incorporate an active ingredient into a delivery system in a very, very short amount of time, so anywhere from 30 seconds to 2 minutes, whereas now it's really developed into an entire ecosystem. So with the technology, you now have the access to our new MAS dashboard, and on there you actually have a series of classes. So you have 12 classes on there that start from the beginning to the end. So they go from, unboxing it and, what are the functionalities of the unit, to then, how to create different dosage forms, what different bases, how they react inside of it, all the way to, at the end, you actually go into marketing aspects of it. So using, an innovative piece of technology also sets you apart from, the guy who's been doing compounding for the past, 10, 20 years, and they have a stronghold of that market just because the provider knows about them. Whereas if you now have technology that is showcasing, you have the ability now to create a very, very high quality compound in a short amount of time, you now have leverage to then, get more business and more scripts put in. So it's more of an ecosystem now than I would say just a piece of equipment.
I love it. Mark Joyner, Mediska, hope to have you back on the shows and really providing this education and really dialing into how to market and business develop compounding.
At the end of the day, that's what's going to move the needle. The days of old where, you open up a pharmacy in your community, it's like, okay, now we're open. You have to do it a little bit different. You have to think different. You have to get out there. You have to get in front of people. So that's where, having the back-end support that Mediska can provide you with an ecosystem and formulations to where your sole responsibility is just showing doctors what you can do is a game changer.
Thank you, Mark, for being part of the ATRIUMX post show. We're here at ATRIUMX. This is the inaugural conference put on by Dr. Nicolette Matthey, and it was her and Bill Holmes that came up with the idea that we needed a conference that didn't necessarily have an agenda, but when the participants came here, really targeting our independent community pharmacies, what could we be talking about? Kind of like a mastermind environment. I'm here with Rich Danhoff with Independent RX Consulting out of Centerville, Ohio, which is kind of in my neck of the woods because, Rich, I'm from Pittsburgh.
All right, yeah, a couple hours away.
That doesn't make us enemies like Steelers/Browns fans or anything, right? Or Cleveland?
Yeah, not for me. I'm not a big Bengals fan. I'm a Cowboys fan, so we're already, we're already enemies.
We always have been since the 70s.
Yep.
All right. Talk to our listeners, Rich, about Independent RX Consulting. What do you guys do for our community and independent community pharmacies?
Yeah, sure. So we're technically kind of full life cycle of pharmacy. We help people start and buy pharmacies. So those are long-term project plans that sometimes take up to a year or more. And then when we also work with over 100 pharmacies from an accounting and tax standpoint. Okay. So, and that's our ongoing business. It is heavily focused on operational support as well. So getting the financials right, but the financials need to be right so that we can run the pharmacy, efficiently. It's not, we're technically not an accounting firm. I'm a CPA, but my background is actually pharmacy ownership. Myself and my partners owned pharmacies for the last 20 years. We had up to 17 at one point, and I was the CFO. So I went through all the kind of learning phase of figuring this weird world of pharmacy out. And it transitioned into this new role, this consulting role. And again, we work hard to get the financials and the tax returns and all those things that pharmacies and pharmacy owners need. But really our primary focus is on, operating efficient and well-run pharmacies.
Yep. So what's it like to be here at ATRIUMX, a conference that neither of us have really ever experienced before? I haven't experienced a fly-by conference that you have to kind of come up with the content when you get here. I think it's novel. I think it's interesting. What do you guys think of this?
Well, I think it's like pharmacy in general. I mean, right now you got to be creative, right? Yep. And so we're looking for creative solutions for pharmacies. And I like these, this isn't a McKesson or a Cardinal trade show where you've got 1,500 people. There's a much more intimate crowd, and you have much more intimate conversations about, what's happening in your store and what are you doing to change that, right? And it's all about margin. And so what are we trying to do to find different ways to improve our margins in our stores? And I think this is the type of environment that we're excited to be at because, again, you have much more intimate, longer conversations with these pharmacy owners as opposed to McKesson, where you've got 1,500 people, funneling through this massive.
What is the hot commodity in value? The difference between commodity and value and extension, but what's the mix that you're seeing right now to help pharmacies generate new revenue?
Well, I wish there was a magic button or magic something that we could all do, and all of a sudden, we're adding to our bottom line. But I think the key is you can't be stagnant, right? We see a lot of retail pharmacies, and they continue to just focus on filling scripts, right? And there's steps out of that, right? That has to be your base business, or it can be your base business, but you've got to have additive stuff to that. You've got to start thinking about long-term care at home. You've got to make sure you're doing vaccines, and not just, seasonal vaccines, but vaccines year-round. Those are making, $40 a script instead of $10 a script of margin. So, you look at IPC next door with their digital health and those other, programs. Certainly compounding has, so even if you're, and I think something that's new coming in the compounding space is there's a lot more 503Bs. Mm-hmm. And with 503Bs, you can buy and resell, right? You don't have to have a sterile lab where you're making GLP-1s, but you can buy and you can resell. And as GLP-1s potentially wind down, there's going to be other things that you're going to be able to buy in those marketplaces and sell them. And again, a typical retail script is making $10 a script, right? And so when you can find other things that are making, a compound that's making $40 or $50 a script, or even on, these GLP-1s that you're buying and reselling, you could be making $150 a script. Mm-hmm. And so it's those types of things that you have to be thinking outside of the traditional box of pharmacy if you're going to, be able to cover the cost of running these stores, because we know the cost is increasing, right? Our labor has gone up. Yeah. And if you're continuing to just fill, brands and basic generics, then, like I say, you're making $10 a script, you're maybe making an 18% margin, and, you got to fill a lot of volume to cover your cost.
Rich, appreciate you being part of the ATRIUMX 2025 inaugural conference, and looking forward to maybe having you back on and sharing more insights.
Yeah, that'd be great. We'd like to do that.
Thank you.
Thanks.
Hey, we are at ATRIUMX. This has been the inaugural ATRIUMX. What a group of people that come together, decide what you're going to talk about on the fly, and now implement. It feels like a mastermind to me. Dr. Dae Lee is here, PharmD. He's also a lawyer. It's so great to finally meet you in person. We've been connected on LinkedIn for a while. How are you doing, Dae?
Good. Thanks for having me today.
All right, so we're in sunny Orlando. This is a much better situation for both of us because you're up in New Jersey, I'm in Pittsburgh. I didn't know this, but fun fact, it's not a fun fact, it's not fun at all. Western Pennsylvania gets 77 days of pure sunshine a year. And when I come down to see my family down here in Orlando, I'm basking in the sun as much as I can. What about you over in New Jersey?
Yeah, same thing. We get limited sunlight, and I'm enjoying my time in Orlando.
Absolutely. All right, Dae. So, number one, let's just start here. You're a pharmacist and a lawyer. How did that come to be? What happened in your life that you're like, wait a second, I'm a PharmD, I'm a pharmacist, I want to put the law on top of this?
I always liked I always had the idea of becoming a lawyer, but when I started my pharmacy school, and then at the end of my 6th year, I did a lot of externships, and one of the externships was at an investment bank, and then there were a number of attorneys who worked there, so I got to learn their practice, and I was trying to figure out a way to combine my pharmaceutical knowledge and the legal knowledge, and here I am today.
This is cool. We need more. I think of Darshan Kulkarni, who's been one of my friends forever, and I always say to him, we need more pharmacists who are also lawyers to really help us, because there's things that you understand, and reading of contracts, and just being able to mitigate all the All the deep weeds of policy. So let's talk about that. What's happening in our pharmacy right now that you're recognizing through your firm, and how you're impacting our pharmacy profession?
Well, as you may know, pharmacies are in a tough spot right now. The reimbursement rates that are set by PBMs have been low, even below water. But I feel like the outlook is positive. PBMs are getting a lot more attention from the Congress level and the state level, and plan sponsors, employers, are now more educated on the games that are played by the PBMs, the spread pricing tactics, and also the rebate aggregator tactics that contribute to ever increasing drug spend, but also below water reimbursement to the pharmacies. So I feel like the outlook is positive. We just need to push through it.
So when I think about this, I think of this conference where we're coming up with other ways of being profitable. They're talking about long-term care at home, and they're talking about functional medicine, and they're talking about being more consultative and making money maybe through telehealth. When you're thinking about that, is there anything that sticks out to you as a lawyer to say, hey, time out, let's make sure that you're crossing your T's, dotting your I's, and not getting into hot water?
Right, all those topics, and also including compounding. There are, healthcare and pharmacy fields are heavily regulated. There are a lot of loopholes that you need to watch out for. So you really need to speak to an expert before you engage in, or put your eggs into a certain revenue source, whether it be compounding, long-term care, or functional medicine. And if you're also setting up an arrangement with telemedicine companies or providers, you really have to watch out for the state laws as well as the federal laws.
Is there any specific telehealth issue in one state that really sticks out to you that makes it more teethy from a legal perspective that we should shout out to listeners and let them know?
Yes, there are a number of potential issues that could arise out of telemedicine arrangement. Like, for example, many states have a corporate practice of medicine prohibition, meaning that non-physicians cannot have any ownership interest in clinics or medical offices, including telemedicine. And also, right now there are a lot of focus on the enforcement bodies on the pharmacies to confirm whether there has been prescriber-patient relationship in the telemedicine scenario, and also whether the prescriber actually had the visual and audio consultation with the patient in compliance with the state law. So in a way, they're looking at the pharmacies to do the due diligence for the telemedicine provider. So pharmacies have to really look into the details of making sure that telemedicine providers are conducting their operation in line with the applicable federal as well as state laws.
So when I hear you say that, the very first thing I think of is an insurance company that owns a pharmacy. Why doesn't that stick out, do you think, to our state and federal regulators of saying, holy crap, this is a conflict of interest?
Well, nowadays, right now as we speak, it has stuck out, and then FTC's looking into it, Congress looking into it. There's a lot of power players looking into that model, because PBMs are they're very near to perfecting that vertical integration. Now, if you look at the vertical integration current setup, the PBMs own, under the same umbrella, PBMs own insurers, the PBM, rebate aggregator, specialty pharmacy, retail pharmacy, all under one umbrella. They also have GPOs. And one of the major PBMs are now considered the largest primary care physician employer in the country.
Yeah.
So we've let this happen, and now we are trying to, take it back. And again, I feel like the outlook is positive, because more people, whether it be pharmacy level, provider level, or the employer level, or the legislative level, are being more educated, and how it actually impacts the patients.
When I think of our government entities, the FTC, for example, that's supposed to protect us from a trade from the consumer's perspective, I immediately go back to what I remember in the 90s, learning of what happened in the 70s and 80s with divestiture of the bells. And the bells were 5 to 7 phone companies throughout the country by AT&T, and FTC broke them up so that they didn't have control of all communications. They had control of long distance and local. So to me, that's less dangerous to the public than healthcare, for God's sakes.
Of course.
So I don't understand why this is taking so long for Congress, for the FTC, for FDA to look at this situation and say, this is not in the best interest of literal health, where we have stories that people have passed away because of them not being compliant on their medication because they couldn't afford the medication. So I hope this accelerates, and I don't know what you see, Day, in if it is accelerating and what you think maybe an outcome would be based on other cases that you've seen, maybe smaller cases, but this is huge.
Right, this is huge, and PBMs have gotten very, very large, and they spend millions of dollars on their lobbying power. I think 2023 or 2024 was the year that they spent the most, and that's the year that Congress level, there was a lot of activity to investigate PBMs and to make it more transparent. So I think it's we're still in a fight. If we had this conversation 5 or 6 years ago, then I would have said, hey, we're still far away from making this playing field, fair. But now, the momentum is on us, and we just have to push through it.
All right, so someone's listening to you, pharmacy owner, maybe they're expanding, maybe they're doing something, they have some questions. How do they get a hold of you?
Well, they could, go onto the website, or they could email me or call me, they could call my cell,
I'll put your LinkedIn profile in our show notes. Day Lee, PharmD. Hey, that kind of rhymes. And just reaching out to you because I'm sure there's organizations and people out there that have more questions.
Appreciate it.
Thanks for being part of this.
Thank you.